Everyone, greetings to all of you. More than 500 million people are living with diabetes worldwide, affecting men, women, and children of all ages in every country. 10% of the adult population 20 to 8 years age group has diabetes, with almost half unaware that they are living with this condition. In Ayurveda, diabetes can be closely related to prameha rogas, which are categorized under urinary disorders. Pra means excess, meha passing of urine. So prameha is passing excessive urine and turbid in color. Prabhuta avila mutra. In further classification, prameha rogas categorized Vataja, Pittaja and Kapaja according to their dosha involvement. Madhumeha or the diabetes mellitus is one of the 4 types of Vataja prameha. When a person has diabetes, insulin is either no longer being produced or there isn't enough. In Ayurveda, Charaka Sanhita, Sushruta Sanhita, like medical books tell that this Madhumeha affects person's ojas, the vital essence of all dhatus. According to the dosha involvement, with organs and different systems, early signs coming to appear, but most people do not aware about these signs. So today we are going to talk about the early signs of diabetes mellitus, so you can check and identify your disease. Increased visit to the bathroom. When you have diabetes, your body isn't able to break down food into sugar, which means there is more sugar in your bloodstream. One of the most effective ways for your body to flush out this excess sugar is passing out of your urine. While peeing regularly throughout the day isn't that much of a big deal. More attention should be paid if you walk up during night to urinate. Once or twice, that is also normal. However, when your sleep pattern is being affected, that is definitely a cause for concern. Another thing you should pay attention is the amount of urine you excrete. A common complaint in patients: I don't drink much water, but how it is possible to have so much trips to urinate? The answer is absorptive property of glucose. As it passes through your way, it will soak up any fluid along the way. This may leave you dehydrated and devoid the energy. If your daily life is disturbed by your urge to urinate, it's a cause for concern. Red, swollen, tender gums. One of the early warning signs of diabetes is gums pulling away from your teeth and your teeth become loose, bad breath and nasty taste in your mouth. In Ayurveda, we call this condition as maladanta. Erectile dysfunction. Diabetes can affect sexual life for both men and women. That is one of the common signs of diabetes in men. What happens is increased blood sugar levels have an impact on the blood vessels and the nerve systems that are used to getting or maintaining an erection. And diabetes directly affects autonomic nerve system. This system controls the narrowing and widening of blood vessels leading to the penis. As a consequence of this, there is an ineffective blood flow to the penis to maintain an erection. Headaches. Headaches can occur for various reasons. But if you find that you are having headaches often and are becoming more intense, it's time to get worried. The fluctuations caused by the blood sugar levels result these headaches, especially face headaches. These changes are associated with the hormones which are cause tightening of blood vessels that go to the brain. Sweet, smelly breath. Studies have shown that gases in the breath of adults are associated with blood glucose and blood ketone levels. There is an extreme and dangerous hypoglycemic condition if you have this type of complications, and is a condition that your diabetes is out of your control. If diabetes is not being managed properly, there is a lack of insulin that helps to deliver glucose to the cells. This lack of glucose leads to use fat to get energy. The main byproduct of this process is ketone, which accumulate in your blood and slowly into the urine, which give a fruity smell. And another fact that researchers have found that it's really possible that measuring the breath of children will help to identify diabetes early. Most children with this smell stand a good chance that they may have diabetes. So beware about your breath and your loved one's breath as well. Dry skin. When your glucose levels are high, the body responds by causing excessive urination to get rid of this condition. At the same time, the body is losing a lot of fluids. That will lead to a dryness of the skin and scalp. If you find you're struggling with dry skin and a dry scalp and dandruff, it would be a symptom of diabetes. Pin and needle sensations. One of the most common symptoms of diabetes is an unexplained tingling in your arms, legs, hands and feet. The cause of tingling and numbness from diabetes is usually peripheral neuropathy or nerve damages in the arms, legs, hands and feet. This complication results from increased blood sugar levels that damage nerves and blood vessels. You experience unexplained excessive thirst. No matter how much liquid they drink, they still feel dehydrated. This is because your body is pulling as much as fluid as it can from your muscles in an attempt to dilate the blood and balance out high sugar content. You feel shaky and hungry. One of the early warning signs of diabetes is feeling shaky or unsteady on your feet. When this happens, you usually grab a sugar-loaded snack or a carb, but this exacerbates the problem. When you have high blood sugar in your body, the body is struggling to regulate this condition. A snack that is high in carbohydrate or sugar causes your body to shoot out a little too much insulin, resulting in a sugar high and dip. This is what leaves you feeling shaky and craving carbs and sugar again. This is a vicious cycle. So it's best to find the right food to manage these high and lows and keep them under control. Feeling tired all the time. An overwhelming sense of tired could be a sign that your body doesn't break down the food properly and converting sugar into energy your body needs for food. Furthermore, your body won't be able to handle different tasks in this state. Physical activities, long-standing sessions, everything similar will be impossible. People always ignore this symptom as something normal. You may experience impaired driving skills, reduced attention, and even mild hallucinations. Don't risk yourself or the life of others. Get checked to make sure your health is in a good condition. Feeling grumpy and irritable. You might become short-tempered, feeling irritable, or even feeling depressed. High blood sugar levels mimic these symptoms. However, your mood might lift as soon as you are eaten and your blood sugar levels have normalized. If you notice this change in mood after food, it's worth to check your blood sugar levels. Losing weight. Losing weight unexpectedly without changing your eating pattern or exercise routine is one of the silent symptoms of diabetes. This happens for 3 reasons. It's a result of losing water from excessive urinating. Second, your body does not absorb all the calories from the food from your diet. Third reason for weight loss is lack of insulin. The body uses insulin, the hormone, to break down sugar into fuel for your cells. When insulin cannot do this job, the body starts break down protein in your muscles. If diabetes is not controlled for a long time, you are going to lose your muscles and call for weight loss. Blurry vision. The eyes are the most sensitive part of your body. They are the biggest red flag when something is really changing, really something is wrong. In early stage of diabetes, the eye's lens isn't focusing correctly because there's a buildup of glucose and they change its shape temporarily. Here you experience blurry vision. If not treated, these changes can get worsened and lead to loss of vision and blindness. Slow healing sores and frequent infections. A common warning sign of diabetes is slow healing sores, frequent infections. Diabetes causes your arteries to harden, prevent the artery walls from being flexible. Blood flow becomes and more disturbed. Oxygen will be scarce in the injured areas, so healing process gets delayed and secondary infections can play early. High levels of sugar in your urine and vagina become a breeding ground for all sorts of bacteria and yeast. If you're suffering from recurrent UTIs, it can be a causative factor to concern. You should definitely test your glucose level. Diabetes is a silent killer. If you ignore this condition, you will end up with severe damages. By keeping your HbA1c level back in target, you can avoid further complications and lead a healthy, happy, and normal life, just like a normal individual. So I think this video gave you a comprehensive knowledge how to identify signs and symptoms of diabetes. See you in my next video. Thank you for watching.